So when I went and I told my local senator about getting kicked when I was pregnant, that caught her attention.
Welcome to the Built on Results podcast, a series of conversations about the issues, the advocacy, and the wins on behalf of emergency physicians. Dr. Chrissy Campana is president of the Ohio chapter of the American College of Emergency Physicians. She's also an attending physician at the Cleveland Clinic. She credits some serious storytelling about violence in Ohio's emergency departments for helping to drive action on a proposal to protect physicians and staff from personal attacks while at work. This is Episode 5, We're Not Your Punching Bag.
It's a huge problem. So I get some type of violent interaction, whether it's verbal or physical, almost every shift. And I think that a lot of our colleagues can relate to that and have experienced the same thing. Our nurses have a lot of violence against them as well in the same ways. And it makes an unsafe environment to practice medicine. And we can't practice and keep patients safe if we're not safe. So it's a really big deal.
Why do you think there is so much violence in emergency departments today?
Well, we often see patients on the worst day of their life. Emergency departments are really busy. I think it's very multifactorial. It depends on the day, depends how busy the department is. It depends how long people have been waiting. We have a lot of ED boarding happening in emergency departments across the country. So that prolongs wait times for patients a lot. And when you don't feel good and you're waiting, sometimes that could make people upset. We see a lot of psychiatric illness in the emergency department as well. So it's a lot of combination of different factors that probably make it the perfect environment for violence to ensue.
Ultimately, you decided to do something about it. You went to the state capitol and you passed a law. Tell us about it.
So Ohio recently passed House Bill 452. In the gist of the bill, it was to assist in workplace violence. Our legislators heard our cries, realized that workplace violence was a problem, and House Bill 452 pretty much sends a clear message that violence against healthcare workers isn't part of the job. Emergency physicians and care teams deserve the same protections as other frontline professionals, and that's what that legislation provides. It also provides some preventative measures, accountability for hospitals to send reports of their workplace violence incidents. So it's going to create some data, and it's going to strengthen protections for healthcare workers.
What was it that led you to decide that passing a law would be the right approach?
We kept hearing from our members of how violence has increased. National ACEP did a survey and found that over 90% of emergency physicians experienced some type of workplace violence. And that number is way too high. So in an effort to help protect our healthcare workers, which also helps protect our patients, we initiated legislation that would do so.
How did National ACEP support the chapter during the process?
So National ACEP provides support for the state chapters when we advocate for something. They do so by spreading the word. So they'll include stuff in their news, their news outlet, their advocacy reports and things like that. They just provide support. Ohio, the chapter does most of the work because we have our relationships with legislators, we have our lobbyists for our chapter, but ACEP always provides support for this type of legislation. When they find out that we're doing and working towards something like this, they're very vocal about their support.
It's always great to have a bill passed and signed into law. What was the secret to getting this done?
So we met with our legislators and told our stories. I sat with my local legislators, a bunch of other members sat with their local legislators, and we told our stories. We have a lot of data, but the stories really bring a connection to that data. So when I went and I told my local senator about getting kicked when I was pregnant, that caught her attention. And those are the kind of things that get legislators' attention, is telling them your personal stories. They don't work where we work, So they need to hear what's happening on the front lines. And the only way to do that is to meet with them and tell them your stories. And that's exactly what we did.
Now that the law is in effect, how's it going?
So it's early to say. I don't speak for my hospital, but I can tell you what we're doing so far is that we've actually formed a workplace violence committee at the hospital. We have a lot of resources in place already. So we've been tracking incidents and keeping that data so that when we have to present it, it will be ready for presentation. We have police officers in our emergency department at all time, and making sure that those police officers have appropriate de-escalation training, other training tactics that will help reduce violent episodes in the emergency department. Those are things that we've done to help our emergency providers and our patients. Other hospitals, I can't speak for what they're doing. It's going to be resource dependent for them, but this will get the ball in motion for them to what the expectations are of the legislation so that they can start doing that process for their own facilities.
Has the presence of the law helped you and your colleagues feel a little bit better knowing that there now is a process in place, maybe light at the end of the tunnel?
All hospitals have a process of filing a serious event reporting system. Violent events are part of that reporting, and I feel like it's made my colleagues and my residents and medical students know that there's somebody that's listening outside of the hospital and making sure that there's accountability for everybody involved.
Every emergency physician in the country is dealing with this, and other chapters absolutely may be thinking about what they could do along the lines of what you did there in Ohio. What's your message to them?
My recommendation would be to meet with your local legislators. They're very accessible, and that's one of the most surprising things about advocacy is how easily you can meet with somebody from your local legislation. And my recommendation would be to tell them their stories. They don't know what's happening on the front lines. You do. And the only way that they're going to be able to hear is if they hear directly from you.
What is your call to action for your colleagues right now on this issue of violence in emergency departments?
It's extremely urgent. I mean, it happens every day on shift for most of us. And it's become an accepted part of the job, and it shouldn't be. When emergency departments are the safety net of the healthcare system, we care for patients during the most stressful times, but it can't come at the cost of the safety of the people providing that care.
Every day from now until March 28th, we'll feature a different story about the work of ACEP and its chapters. We'll talk about advocacy wins and work still underway to make sure you can do your job. We kicked off the series on March 11th. You can listen to those conversations and read more about the Ohio law to address violence against healthcare workers by clicking the links in the show notes. There's also a website, acep.org/results. You've been listening to the Built on Results podcast, a production of the American College of Emergency Physicians. We're back tomorrow. Until then, have a great day.